Hello and welcome to the Dulcie Simons Jr. Family Broadcast Studio. We are so glad you can join us as we announce a new and exciting partnership. We have several guests helping share this really good news today. In studio with me are Bob Page. He is the president and CEO of the University of Kansas Health System. And we have Tammy Peterman, president of the Health System's Kansas City Division. Joining us live from Dole Hall at Kansas State University, we have Marshall Stewart, senior vice president and chief of staff at K-State. And we also have Jessica Nadd, director of K-State 105. We are going to learn a little bit more about K-State 105's initiative here in just a second. Later, we will hear from two experts working with K-State Research and Extension. Jessica Coates is Midway District Director and a Consumer Sciences Extension Agent. We have Elaine Johannes. She is a professor in Community Health and State Extension Specialist. They are joining us from Ellsworth, Kansas. We'll also talk with Dr. Craig Concannon, an internal medicine specialist at Beloit Medical Center in Beloit, Kansas. News media will get a chance to ask questions following this announcement. When doing so, please provide your name and your news outlet. Let's begin with Marshall Stewart in Manhattan. Marshall, I'll let you do the honors and get us started.
Oh, thank you, Jess. It's good to be with you today, and I'm excited to announce with our partners at the University of Kansas Health System a new, unique collaboration through our K-State 105 initiative. As a next-generation land-grant university, Kansas State University has identified community health and well-being as a focus area for engagement and transforming lives in Kansas. We are delivering on our land-grant promise to serve the people of Kansas. We are thrilled to collaborate with our colleagues at the University of Kansas Health System and build a K-State 105 partnership that improves healthcare access for Kansans across the state. This partnership is first of its kind collaboration that will bring together two components, the land-grant mission and statewide presence of K-State through its K-State Research and Extension Network, the expertise and experience of the state's only academic health system. Together, it's going to be something really special. So with that, I'm excited to bring forth now our partners at the University of Kansas Health System, Bob Page and Tammy Peterman.
Well, thanks, Marshall. Great to see you virtually. We are incredibly excited about today's announcement. When you first came and talked to us, last year sometime, I think Tammy and I got really excited about the opportunity that K-State 105 is going to present to not only the University of Kansas Health System, but also to folks entire across the state of Kansas. You know, when we think about it as the only academic health system in the state of Kansas, one of our primary responsibilities is to make sure we take care of Kansans and we improve the health of Kansans. And we believe in concert with K-State 105 and in building on the CARE collaborative that we started 10 years ago, this is an ideal partnership for us to be able to deliver that care. We know care is best delivered close to home. We believe in concert with K-State, if we can bring our expertise and resources to bear, we will be together, we'll be able to do some amazing things for our citizens of the state of Kansas. So I can tell you on behalf of the health system, we are very excited about this opportunity, and I know Tammy has a few comments to make as well.
Sure. Thanks, Bob. I am so excited about this. You know, I grew up in a small community in western Kansas, and I'm the daughter of a physician who practiced in that community, and I just know how important healthcare is to all counties in our state, and certainly to rural communities as well. And we know there are needs across our state as a healthcare landscape just continues to change. We know that this opportunity will be great for Kansans across our entire state. As a healthcare system, we make decisions by asking ourselves first, what is the best and right thing to do for patients? That's really a guiding principle for us. And there is just no question this collaboration with Kansas State will be good for patients, for rural providers, and for our communities. I think also a benefit from this collaboration will be we will continue to learn more and more from providers and organizations in communities across our state, how we can learn from one another. There can be some sharing from things in our health system, certainly sharing from communities and the great work that's happening in healthcare across our state. One of the things I love so much about this partnership is that as a health system, we are always broadening our partnerships, and we love to partner with other great organizations. And that's exactly what's happening. And we're doing that in the spirit of helping patients, which is awesome. So we are excited about this right here on our campus, and we're excited to hear a little bit more from, I know, others on this call.
Yes, let's get to Jessica Nad. Tammy, thank you so much. Jessica is the director of K-State 101. Good morning, Jessica.
We know that access to health care is an issue affecting economic and workforce development across Kansas, but especially in our rural communities. Through K-State 105, we are supporting economic prosperity in all 105 counties of Kansas, and that means supporting Kansans in the communities where they call home. So we know that we cannot do this important work alone, and that's why we are building a higher education network that helps create this access of expertise with other organizations. And so that's just one of the many reasons why we're so excited to partner with the University of Kansas Health System. Our partnership with the University of Kansas Health System is just the beginning. It's a way for us to collaborate and to empower Kansans to find local solutions that work in their local community, just like Tammy mentioned. So now joining us from Ellsworth, Kansas, welcome Jessica and Elaine.
Thank you, Jessica. So as K-State research and extension agents, we often live in those same communities we work. So we understand and see firsthand the costs of poor health. My job as an extension agent is to help people live healthy lives. This partnership is another great way we can help equip the people in our community to do just that. It opens up new opportunities and a way that we can offer new tools. We're looking forward to exploring how this K-State 105 partnership with the University of Kansas Health System can continue to benefit communities like ours.
And Jess, first I want to thank you for inviting me out. Ellsworth County is beautiful today, and the drive out was great. I too want to lend my support to this partnership, which is a cutting edge initiative between K-State University, University of Kansas Health System, and Extension. From the Extension standpoint, Extension agents such as yourself have had a long history of addressing health issues, as well as some of those economic development and family health issues. By being change agents in the community, our agents are able to weave together science, practice, and understand the context of community, which is the land grant approach. So I really appreciate your work and the work of other agents across the state. That work is going to really amp up, expand thanks to this collaboration and partnership, and it'll bring some thriving and well-being to the people of Kansas where they live, learn, work, and play. So the whole Kansas initiative and all of our well-being will improve. So I want to thank everybody for this effort.
Elaine, thank you. And let's get to someone practicing medicine in rural Kansas. Dr. Craig Concannon is in Beloit. Dr. Concannon, good morning. Oh, Dr. Concannon, can you unmute yourself? Oh, we're unable to hear you.
I'm a novice at this, so.
That's okay. That's
anyway.
Okay.
We're very excited about this opportunity. You know, the University of Kansas Health Systems has really been on the forefront of recognizing the challenges of rural healthcare across the state, and several years ago developed the Kansas Clinical Improvement Collaborative, which was initially 13 counties in the northwestern part of the state, in an effort to enhance the rural healthcare and stabilize those medical communities in those regions. That has expanded to 73 counties across the state and 85 members in addition to that. And that's what we've recognized through that is how important it is to have ability to have local changes, yet have some guidance across the whole state. And certainly during COVID, they were very instrumental in helping rural facilities particularly maintain the expertise and the equipment that they needed to take care of those patients. So this is just an extension of what the University of Kansas Hospital has done in recognition in all these counties that have issues with housing, with education, with child care and transportation that all feed to the stabilization of the economy of the county. So we're very excited about this opportunity.
Dr. Concannon, thank you so much. And to everyone on this panel, let's see if any of the reporters listening in have any questions. And please do remember to say the name of your news organization with your question. We'll pause for just a few moments. So while we wait for any media questions, I wanted to ask a couple, if you don't mind. And I was going to start with Jessica Nadd. How did the idea of this partnership come about?
Yeah, so I believe this partnership is a part of the K-State Next Gen mission to be able to open up our university to extend that expertise across the state, which is something that we've always done. But the K-State Next Gen initiative is doing that to a much higher level, and it's very exciting.
And I wanted to ask Marshall about the land grant promised. What is that? Tell us more.
Well, as a land grant university, our history goes back to 1862 when Abraham Lincoln signed the Land Grant Act, and the idea was to bring access and opportunity for all to come to a university. Prior to that act, actually, universities were very exclusive, and basically people didn't have that access, and that changed it. And Kansas State University was that first operational land grant in the country, in fact. And so across the country now there's a whole network of land grant universities. It's really about access and opportunity. It's about building a middle class, which was originally part of the intent of the Land Grant Act. So when we talk about the promise was that we would, number one, create access. Now, access is a two-way street. It means not only can you come to us, but also we're going to go to you. Just a few minutes ago, you heard from some of our great K-State Research and Extension professionals, some of our agents and one of our faculty members there. And they really do the hard work, the great work that goes on in community. They're the ones that really expand and take knowledge from the Land Grant University into the community and enable us to educate people about their lives, whether it be in areas of health or agriculture or youth development or what have you. It's that promise of the land grant. So when I think about this partnership with KU Health System, it's a remarkable opportunity to take our network, which we have and have had for well over 100 years now, based in all 105 counties, and how do we now leverage that to bring better care, better access, better education, to be able to leverage the great work that's done at KU Health System and bring it into communities. We already have recognition there through K-State Research and Extension. We already have trust there. Our people on the ground working every day in those communities in partnership with county extension boards already have that trust, that factor of knowing what's going on in community. So we're able to bring that knowledge of what's happening in community to KU Health System, and they in turn are able to bring the solutions into that community. So it could be educational, it could be at some point care, it could be leveraging whatever we need to do in telehealth or direct care. As Bob said a few minutes ago, people getting care where they live is very, very important. And we believe through this partnership we can extend what KU Health System wants to do, which is to bring care and healthy lives to people in place. By leveraging our system, we can do that and bringing that, again, in partnership. This is a unique partnership. It's a one-of-a-kind thing. But if you go back to the land grant mission and the land grant promise, it's always been about partnership, whether it be with us in the counties or with us in another institution like KU Health System. It's all about serving Kansans, and that's really our promise and our commitment to the people of Kansas.
Marshall, thank you. Bob and Tammy, how does this particular partnership really fit in with the University of Kansas Health System's mission?
Well, I can take a shot at that, Jess, before I turn over to Tammy. Quite frankly, if you go back to the legislation that created us back in 1998, one of the ideals that was created was it was our responsibility to improve the health of Kansans. I think our initial attempt at that was to continue to provide access to Kansans to the University of Kansas Health System. And today we take care of patients from all 105 counties in the state. 10 years ago, we decided we need to figure out how to take care out to Kansans. We created the Care Collaborative. And when Marshall came with the idea about how could we partner the Care Collaborative concept with the extension offices, it made perfect sense because not every Kansan can get to our campus. So how can we take care out? And now through the extension offices that have great credibility in their communities, I think it's another avenue for us to be able to just extend our resources and our expertise combined with local providers like Dr. Concannon to actually benefit all the Kansans that we're able to serve.
I think that's exactly right, Bob. And one of the things we work on is making sure that we can provide care as close to home as possible. We've all talked about how important that is. I think this is just another way to help support that major concept. And although we take care of patients from every county in Kansas and certainly every state in the country, we can't take care of, not everyone has to come to this campus. If we can do things and people can remain in their communities, that's a win-win, I believe.
I want to go back out to Elaine and Jessica Coates. What makes you most excited about this opportunity?
Jess, I might start if that's okay.
Go for it.
I am most excited about this opportunity to weave together the strength of K-State University, which is not only in our science, animal health science, people science, but also in our teaching too. I am a faculty member in the Department of Applied Human Sciences, and I get the privilege of also supervising students. Those students primarily are from this state and would probably like to have an opportunity to practice, go back home, practice their profession in the state, and then weave together other systems and other resources, such as what the University of Kansas Health System has. So it brings the whole state up to the potential to not only attract new organizations, new businesses, new opportunities to the state, but then to retain people who love our state very much. Jessica, I don't know if you have any perspective to share.
No, I love that. And I often say, teamwork makes the dream work. And we're doing the boots on the ground work at the university level. I like to say, too, that I help people live their best life, their healthiest life. And by partnering with the University of Kansas Health System, we can only improve and empower people to live a better life. It's just, I can't even imagine how great people's lives are going to increase by this partnership.
Thank you both. I think we have some media questions. Heather Hollingsworth, go ahead with yours.
Just a real basic question. I'm not entirely clear I understand how this partnership works. Could you just, real high level, what are we announcing today?
Who wants to jump in on that question?
I can hop in on that one. So the announcement today is announcing an agreement between Kansas State University through the K-State 105 initiative and the University of Kansas Health System to say that we're putting our heads together, that we're coming up with a plan, and that we're going to find ways to deliver our shared expertise between the both of us throughout the entire state of Kansas. So that's actually a core tenet of the K-State 105 initiative, which basically says that we are looking at communities across Kansas. We are looking at issues that affect workforce. It could be housing, healthcare, childcare, just like Dr. Concannon had mentioned earlier. And we know that communities that focus on the health and well-being of their citizens in a dimensional way, those communities grow and thrive. And so for us, this is building an ecosystem approach across the state of Kansas. This is partnering up. This is doing something together that each of us could not do alone. And that is really what we are announcing today.
And if I can add to that, I think there's a couple of other things I would share. One is that if you think about a community, getting their needs assessed, that's something that Extension has done extremely well. One of the beauties of Extension is we have a presence in 105 counties, 2.8 million people. That's our student body when we think about the state of Kansas. And our job is to really serve the needs of that by our charter as a land grant. So part of that is assessing those community needs. What is it that's going on in this community uniquely related to healthcare and health overall? How can we leverage the great expertise we already have through our Extension network, our health educators, our folks that work as agents in the field in nutrition and other areas? And then how can we then utilize them as connectors? Maybe there's a unique thing there that KU Health System could really help with. Maybe there's an expertise they have that maybe a rural community wouldn't even know it's there. And it could be in education, it could be in support, it could be access to certain expertise. We just don't know what that is yet. But part of it is our ability to be on the ground and learn and then inform inform KU health system even better with real time, real information, and then bring in that expertise and utilizing our network as a lever to bring that in. So I think there's just lots of opportunity in this. We have incredible people all over the state working for Kansas State, bringing that together with the incredible, robust mission and engine that really the University of Kansas health system has become. I just think it's a natural partnership and something that I also believe that the people of Kansas deserve. And that's one of the things that I'm really excited about, is seeing these two entities come together in this way to really serve the needs of Kansans. So we don't know where it's going to take us exactly, but we do know that we have to take this step to get beyond and then move into those solutions for Kansans.
Beck Shackelford is on the line with us. Beck, what is your media outlet and what's your question?
Hi, can you hear me okay?
Yes.
Perfect. Yeah, I'm Beck Shackelford Wanganga of the Kansas News Service. We're an NPR station in Kansas. And I was just curious, I know it sounds like there are still some unknowns here, but I'm wondering what are what are the boots on the ground actionable items going to look like with this? And if we don't have an answer for that quite yet, what are the first steps in, beginning this partnership?
Elaine, please.
I apologize. I can hardly wait to speak. And thanks to both of the questions. Heather, you started off, and this is absolutely what I was thinking about from a state extension specialist standpoint. And that's my role. That's my job. I get the privilege of working with all 105 counties, our district offices, professionals such as Jessica today. So from a very boots on the ground, right, can we start perspective, many of the other state extension systems are already doing work around clinical translation work. So I do know that the University of Kansas, the health system, even the KU Med School is aware of taking clinical practice and making it applicable and accessible out in the field. And as that happens, then people such as myself, people like Jessica, can actually weave together systems of support. Systems of support that address some of those social determinants that we heard from our physician up in the Mitchell County area. Some of those housing, childcare, transportation, broadband, health, healthy food access, some of those things that we know are part of good clinical work and response. So I'm excited by being able to know who to work with at the University of Kansas Health System, to actually have a name and a face, and they will have ours. So I think those are barriers broken down. We know who to talk with, who to work with, and then we can start thinking about bringing some of those larger funds in the state and across the whole state, so everybody has access and opportunity. So I appreciate you guys asking about some of the practicable parts of this.
Anyone else on the panel want to comment on Beck's question? All right, we're going to move on to Jennifer Latsky. Jennifer, go ahead and tell us your media outlet and your question.
Yes, I'm Jennifer Latsky. I am the senior editor for Kansas Farmer Magazine. Real quick for Dr. Concannon, and while I'm doing that, I'll let you unmute yourself, sir. I was wondering, what are maybe the top 1 or 3 health concerns that you see in our rural environments that this collaboration can help us address, whether that's long-term health needs like cancer or diabetes, or something along the lines of preventative or medical response. Thanks.
You're welcome. Well, first and foremost, you have to be able to provide healthcare locally, and it's very challenging in this environment with the changes nationally and somewhat even statewide. And in order to do that, it really takes the community. So, we have to be able to have adequate housing so that people want to stay or come back and work in your community. You have to have good education in order to do that. We have to have transportation for people to get to the health care that they need, either locally or if they're going to see a subspecialist elsewhere. It's really providing that primary care base in the rural area to the most effective way. So it's really a community effort, and that's why we're so excited about K-State Extension bringing it, because every community has its own local issues, and the extension agents obviously are more familiar with that. It's just not a blanket fix for the entire state. It's really on a local level.
Going to leave the last few seconds for any last media questions.
Hey, yeah, this is Beck again from the Kansas News Service. I was just curious, do you have any specifics on how this partnership will expand that provider base, like you were saying, and provide provider care in rural Kansas?
Who would like to answer that one? Beck, who might that be directed to?
I mean, honestly, anyone. Yeah, whoever wants to take a stab at it, I'm interested in hearing.
All right, Bob, Tammy?
Well, I think we don't have the specifics of it. As you've heard a number of people talk about, we're working on determining what some of those next steps will be, working together to identify what the needs are in a number of different areas and communities, and then figuring out how we can partner to identify some ways that from the University of Kansas Health System we can help address those. Some of those needs will be met in a variety of ways. We've talked about education, we've talked about support for providers or support for caregivers in communities. There are a lot of different things. I think this will be a really wonderful collaboration for people to follow and see what will this look like in the next 6 months or the next year. And I will tell you, we'll have more specifics. We're working on those now.
You know, Jess, if I could just add, one of the things when Marshall came over and explained this to us that really resonated, I think, as we had the conversation. In 10 years in the Care Collaborative, what we've learned is that we have been able to reach out and partner with local providers like Dr. Concannon, and we've been very successful and spread that across the state. But it's still hard to get to rural populations as much as we would like to. And then when Marshall came in and said, well, let's talk about extension offices. They serve 105 counties just like we do, but they also have a reputation and they're trusted in their communities. And sometimes in healthcare, there's some skepticism about healthcare. So if we could partner with an extension office that has a great reputation, it's just another avenue for us to get our resources and our expertise in concert with what we already have in the extension offices to perhaps even reach more Kansans in rural areas that don't have to go through a hospital-based situation, but can actually get connected to us through extension offices.
Last call for media questions. Yes, please,
can I add one thing to that? I think what Bob says is really important, that one of our goals is, when you think about sort of expanding care, that can be done in lots of ways. And one of the things that you can do is you can give greater educational tools, experiences, et cetera, to folks, and maybe not have to have as many boots on the ground in some areas, or maybe help those that are there doing the great care, like our doctor with us today, even do a better job and have more expertise that he may need and have access to that. I think another thing is the whole area of telehealth and how that expands. I think there's going to be lots of ways that we can bring greater care, and care can mean lots of things. It can be preemptive. It can be during the actual care that they need, or it can be, again, helping people make better decisions. We are in the business of trying to help Kansans. So what that care looks like, I think it may look very, very unique, and as you might think about a person, or it may be through technology, or it may be through education to reduce the amount of care they need. I mean, all of those things kind of go in tandem. So I think there's going to be a lot of learning. And one of the things I thought was really important, Bob, when we had the conversation was this is really an iterative process. As we go into this, we're going to learn. We're going to say, well, we thought that was right, but this is even better. And so it's going to be an iterative process. But the commitment we have from Kansas State University and the University of Kansas Health System today is that we're going to get this done, and we're going to serve people's needs, and we're going to make sure that we don't leave anyone out there that possibly we can touch or reach not having the care and the support they need as it relates to their health.
Any last media questions? Dr. Concannon, please.
adding on to that, we found through the collaborative that more and more of our healthcare can be given at home, so that patients don't always have to come to either the doctor's office or the hospitals to receive that. Broadband is very important in that. Remote patient monitoring is very important in that. And we just need to have increasing access for people to get their health care without having to travel so far, without having to displace themselves, long-term care in patient care at home. All those things are really important as we move forward with our healthcare transitions.
One more last call for media questions. This concludes our exciting announcement this morning. Thank you so much for being with us.